Hello, I'm Dr. Vedrana. I'm internal medicine specialist, and I'm here with Dr. Amani, specialist psychiatrist, and Ms. Anu, clinical psychologist. We are discussing mental health in adolescence, and this is our second panel. The first one was on mental health in children that was conducted in Zuleika Hospital, Dubai. And all of this is within Happy Minds campaign by Zuleika Hospitals. You must be wondering why I, as a physician, am discussing mental health. Well, it's important to understand that mental and physical health are very much interconnected. So any physical illness that you have will state to a certain extent. But when we talk about adolescence, even a normal physiological process such as puberty has a great impact on mental health. Usually, all those hormonal changes, body changes, maturing lead to development of a normal young adult. But if this person has some other comorbidities such as diabetes, obesity, acne, or some other condition, this development may be affected. Therefore, it is important to recognize this and treat it timely. On the other hand, certain conditions, psychological conditions that, for instance, we're all exposed to stress, can, over a long period of time, lead to physical illnesses. Those would be, let's say, gastritis, irritable bowel syndrome, headache, and palpitations. So there is the role of physician to recognize this and treat the root cause. So physical illnesses have symptoms that lead us to come and visit a doctor. In the same manner, mental disorders or conditions or issues, have to have certain signs and symptoms that have to be recognized. So we seek professional help in appropriate time. So I think Ms. Anu can tell us more about this.
Okay. As a parent or a teacher, how we can help is we have to be attentive to our teens' behavior. Actually, adolescence is a time of rapid change and a lot of transitions will be happening in that time. But a severe, dramatic or abrupt behavioral changes can be a key indicators of serious mental health issues. So the parents and the teachers can watch the warning symptoms of mental health issues such as any difficulty in sleeping or excessive sleeping that is beyond teenage fatigue level or insomnia, or any changes in the eating habits that resulting in a rapid weight gain or weight loss in a particular period of time, or excessive worriness or expressions of hopelessness or helplessness or worthlessness feeling, memory problems or difficulty in concentration and attending. And also the teachers can take care, they observe their students, like if they are making any unexpected drastic declines in their academic performance, or if they are showing any excessive absenteeism or excessive isolation from their other classmates and other friends. So if you are watching your child is showing any of the symptoms, it is the best time to show and ask for the help of a mental health professional.
Now that we have recognized these signs and symptoms, there has to be something that we can start doing at home to prevent all of these conditions from arising. That would be definitely a good lifestyle. It has to consist of a regular and appropriate physical activity, exercise. Then healthy diet is number one. Also good family relations, good school support system, active social life. All of these things are necessary so a child would develop into a healthy young adult. But if all of this is already done and we see that our child is unfortunately having some of these issues, what do you think, Dr. Amani, would be the best approach to start the counseling without being stigmatized?
Okay, thank you, Dr. Vedrana, for your introduction and for this important question. Actually, the first thing we can do the education for parents and family. The parents and family should be educated about the prevalence and how common the mental illness among our population. So it might be surprising if we say that 1 in 4 people might develop mental health problem at some point in their lives. Also, unfortunately, depression among adolescents might affect around 1 in 12 in whole population. We are talking now about the most common and the prevalent mental health problem should be recognized and tackling it. The other thing, parents also should be educated about the definition and the meaning of mental illness. Actually, the mental illness and physical illness, it doesn't different part. They are considered on the same level. Also, the mental illness, for example, cardiac illness, the main organ affected is a heart. Mental illness, the main organ affected is our brain. So our brain is controlling our thoughts, emotion, and eventually our behavior. Any disturbance of its connection of neuronal circuits or chemical neurotransmitters, it could affect our thoughts and behaviors, and the parent should be educated about this, and sometimes the problem is out of our control. That's why they should seek advice. Also, parents should know that the mental health problem is just a part of a person. It doesn't define a person or labeling them. Also, parents should ignore the misconception and myth related to mental health problem, and they have to acknowledge the facts and reality related to it. So, Ms. Anu could illustrate to us what is the misconception and myth related to mental health problem.
Okay. Actually, as what we know about psychotherapy is coming from any TV or movie shows, definitely we will be having some misguided notions about what is happening with a mental health professional consultation. So that's why many people are trying to solve their problems themselves for even weeks, months, or years before starting the psychotherapy. But the problem is, in reality, there may be a biological component related to this psychological problems. So that's why it will make it incredibly difficult to heal itself. So asking out for help is a sign of strength rather than a weakness. So it is a first step for solving our problems. There is always a myth that the people with mental health issues are having a very low intelligence level. But in reality, many studies have shown that the people with mental health issues having average or above average level of intelligence. Actually, the mental health issues also, just like the physical illness, they can affect any people regardless of their age, gender, nationality, or their intelligence level, or their social status or income level and all. Many people are believing that the children don't experience any mental health issues. But in reality, half of our mental health problems are starting before the age of 14. And third quarter of the problems are starting before the age of 24. And many studies have shown that suicide is the third most leading cause of death in 15 to 19-year-old kids. So if you're watching any of your children showing any of these problems, so it's always good to have a chat with a trained mental health professional. And this is the first step towards a physical and mental well-being.
And when we talk about taking care, what would be actually the benefits of counseling, of coming to see a professional? What do you think?
Yeah, the benefit, number one, we can say having your children's voice to be heard. Also, your voice to be heard. It's a kind of ventilation when you talk to a psychiatrist or psychologist. It's considered a kind of ventilation. Other point, you will face off or confront your fear instead of avoidance. So if you address your problem, you can handle it or manage it better.
Zuleika Hospital has always been a forerunner in creating awareness on various health issues. This time Happy Minds was created to drive awareness on mental health. We hope we have brought you closer to this idea of seeking help. Unfortunately, there is still a lot of stigma attached to mental health issues. Our goal is to remove the stigma, to give you an opportunity to seek for help or get help, professional help, quality help of our team, without being judged. Mental health issues are issues just like any other physical issues, and they need to be treated. That's the important part. Please do not hesitate to contact us, whether it's your family physician or a general practitioner, or maybe you want to go straight to a mental health professional. We have a great team comprised of 2 psychiatrists and 2 clinical psychologists that are ready to help at any time. And remember, healthy mind lives in a healthy body.
Discover the ultimate healthcare experience.